As Daniel Minton, my name is Mary Klaber. I am a regional epidemiologist housed here in El Paso County Public Health. Many people have heard about the outbreak of measles associated with travel to Disneyland in December of last year. As of today, there have been 26 people infected. 22 are from California, 2 are from Utah, and 1 each from Washington and Colorado. And the Colorado patient is the first one diagnosed in El Paso County since 1992. This person was hospitalized at Penrose Main Hospital on North Nevada in Colorado Springs on January 3rd. Because measles is a highly contagious disease, the health department has been working closely with Penrose Hospital to determine what patients and visitors were present in the emergency department or CAT scan suite between the hours of 9 a.m. or 7 p.m. or the 4th floor between the hours of 4 p.m. and 11 p.m. on Saturday, January the 3rd. At this time, over 300 people have been identified as potentially exposed. In order to rapidly reach out to these people, El Paso County Public Health has implemented a standard coordinated response of epidemiologists from the state health department as well as local health departments throughout the state. Approximately 20 epidemiologists are in the process of contacting all potentially exposed people. We have reached 250 people, of which the majority are considered to have immunity for measles disease. People who are considered to be at the highest risk of getting disease are those who had prolonged contact that is close and were close to the patient. At this time, El Paso County Public Health has identified fewer than 10 people who are considered to be in this high-risk category. And those people would be at the highest risk of contracting measles disease. At this time, I will turn it over to Dr. Bill Letson, the Medical Director of El Paso County Public Health.
Okay, and as Ms. Klaber was just saying, as a result of this case of measles in the county, we've been engaged, along with a lot of other people, in tracking and tracing anyone that had potential exposure to the infected person who was in hospital. And one of the primary reasons for calling you all in here is, as Ms. Klaber was saying, we've been able to contact a large portion of that somewhat over 300 people that we need to get in touch with, but not all of them. And we think it will be helpful with sort of distribution of the message through the media. We may actually be able to have some of these people contact us more directly, which just helps to kind of close the loop. As we contact these people, as was said, we determine their immune status. If they're not immune, then there are a variety of ways to follow them and monitor them for any signs and symptoms of the disease. As mentioned, most people in the community, both whom we've contacted, but also in general, are already immune, and by that it's in the 90% plus range. So most people, even in the investigation, we don't really have to worry about further. But we're really looking for that proportion of folks who are not adequately immunized, don't have evidence of past disease, and the importance of looking for those people and for having a special focus on the somewhat less than 10 people that Ms. Klaber mentioned are at particular risk, is so that we can prevent anyone who might come down with measles from this exposure from exposing others in the community who would be likely to acquire the disease. And that includes especially people with some kind of immune compromise. Say, for example, someone who has cancer and they're on chemotherapy. Even if they've had the disease or immunization in the past, with their immune system deteriorating, they may no longer be immune. So they're at special risk. A little less than 20% of children in this community, as well as in the state in general, are not adequately immunized. So that's another group that we want to be absolutely certain that this doesn't spread to. I think that gives us the opportunity to re-emphasize a message that we love to re-emphasize every time we get together with you folks or anyone else. That is that even though 80% of the kids in the community are immunized in the way that they should be, that leaves another little less than 20% that are not. So we really want to once again push the message that people need to be getting their kids in to be immunized with this vaccine. This vaccine in particular, the measles vaccine with 2 doses is over 99.5% effective in preventing disease. So this is a really very important message for you to get out. And with that, I think we'll pause and allow you to ask questions.
So the patient that had measles, she was immunized, right?
The information that we have is a report that she had been immunized. However, because she's actually had disease, she's one of the people in a category that we really, really need to have documentation of that. And at this point, we don't yet.
Would you recommend people get a booster, or is it just, you know, her time frame in the 60s that she got it done? You know, how can we tell the public, you know, here's a person that had the shot but yet still got it? What can we tell them about maybe getting another shot, or?
Well, there are some rather interesting issues there, and this is why it's important that we, especially in her case, that we have documentation. People immunized in the 1960s, if they in fact did get vaccine, up until 1968, all that was available was a killed vaccine, which was not very effective. So if you knew you were in that category of folks and you had never had clinical disease, then yes, it would be a great idea to get the current vaccine. After 1968, the live virus vaccine that we use now is what was in use, and generally speaking, a single dose is over 90% effective. 2 doses, as I said, get you to about 99.5. In that patient's case, we're not sure. We think that she got a vaccine, but we don't know which one, and are hoping later to have documentation of which one.
The people that may have been exposed to her, are they, let's see, have they been immunized? The ones you've identified and talked to them? Yeah,
so far, the people that we've contacted so far, that roughly 250 people that Ms. Klaber mentioned, a little over 90% of them have already been immunized, or in the case of some of those that are older, i.e. born before 1957, they actually had the disease itself.
So kind of explain why they still need to be quarantined or kept away from people even if they haven't had the shot.
The only people that would be subject to being at home through the rest of this incubation period are people in a particular high-risk category. Most of these people that we're following or contacting are not in that really high-risk category and would not be kept at home.
So I'm checking the less than 10 folks who are at that high risk. Are they that way because you guys just can't find their vaccination records, or has it been shown that they actually just haven't been vaccinated patients?
They are a bit of a mixture. They're in a category where we need to be more certain of their documentation of either disease or immunization. So far, they've not been able to produce that. The number that are subject to being to staying at home and away from the general public during this 21-day period has actually been dropping. And that's why that's one of the reasons we're not really saying too much about the specific number other than it's under 10. It's a small number because it keeps changing. As some of these people have been staying at home, they've managed to actually find their documentation. Once they do, they're, at that point, they're able to go on about their normal business. And I would add to that the people that have been subject to this so far have been quite happy to place themselves under this restriction. But they've also been happy to then begin looking for looking for records. So once they find those records of adequate immunization, they're free to go to the shopping center.
Well, and just to be sure, are any of those folks just flat out though they said that never got the vaccine? Just to be sure, I mean, are any of those folks for certain not vaccinated, I guess?
There may be some of them, and that's really mostly related to their age on either end of the spectrum. People like me, born before 1957, haven't had the vaccine, for example. So in that case, you need a pretty good description or evidence from a blood test that you've actually had measles.
The people that you're contacting to make sure that they have not contracted measles, where would they have come in contact with the patient? Be it travel, at the hospital? Could you give us some examples?
At the hospital. The patient was thought to have gotten her case of measles by virtue of travel to Disneyland. Woohoo! I mean, as was said earlier, this particular outbreak all goes back to Disneyland right now, as far as we know. But here in El Paso County, all the exposures were in that period between roughly 0900 hours in the morning and
11 p.m.
11 p.m. Thank you, at Memorial. Sorry, at Penrose Hospital. So that's really the only exposure here. It's all people who were in the hospital and in very specific places, as it said in the press release. And we can limit it to these specific places because of how the air circulation system in the hospital works. So it just comes down to the ED, the CT, the CAT scan suite, and the 4th floor where the patient was kept.
How many more folks do you have left to contact by chance to check for their
It's in the neighborhood of 50 to 75, something like that. And the reason I'm not giving you a very specific number is one of the things that we've learned in the investigation is some of the people that we know were in hospital at the time that they could have been exposed actually had other people like family members with them, and then the number grows. So it's not a number that we can pin precisely, but it's between 50 and 75 that we need to contact still. That gets around to another reason for this conference, because there are some of these other people that at the moment we don't know who they are, and so it's helpful for that message to get out through all of you for the second time.
Explain again, sorry. So in the 1960s, the virus was killed when they had the shot, but now it's live, or how does that work?
Yeah, the original vaccine was a killed virus vaccine, and generally, this is true in general of viruses. Killed virus vaccines generally are not as highly effective as live viruses are. And in that case, we do use some killed virus vaccines, but in that case it turned out not to be very effective, and so they didn't use it for more than a few years.
And so is that window in the 1960s? Is there a certain age, year range?
They used it until the live virus vaccine was licensed. It was licensed in 1967, and then had broad usage beginning in 1968.
Would you encourage folks then if they were born before that, or, you know, what would your message be? Would you like them to come in and get a booster or get the live shot?
Generally speaking, we don't encourage that. I think that if you had spread, which is what we're trying to prevent, but if you began to have secondary cases that resulted from exposure to this one woman, you might begin to think about that. But we normally don't worry about it too much in this day and age, simply because measles is technically eliminated from the entire Western Hemisphere. So from Baffin Bay in Canada all the way down to Tierra del Fuego in Argentina, there's no longer endemic measles, but it exists in many places in the rest of the world. So yearly in the United States, there are handfuls of cases. They're imported. Almost always the cases that occur are generally unimmunized. In this woman's case, we can't say for sure. She may have been, but she may have been immunized with a vaccine that didn't work very well.
Dr. Letson, in relationship to her question, and individuals that may have received the kill vaccine, would it be important for certain people who might have higher risk jobs to consider getting a vaccination?
Oh, certainly, right. I mean, people within the healthcare industry, because they are taking care of, again, people who may be under-immunized or have immune-compromising conditions, are actually required usually to be fully immunized. So if, for example, you had, that's a great question, because if you had a person who was a healthcare worker and was born in that time frame in the 1960s, or let's see, there's sort of this window in between 1957 and 1968, about a 10-year window. If you were born in that era and you knew that you had not had measles, and either had not had any vaccine or had had the old killed vaccine, then what the hospital would actually do is test you to see if you had any evidence of measles immunity. If you didn't, then you would get the live vaccine, or you might get both. So they're sort of in a special category. The general population, not so much, because most of the people in that 10-year window, even if they had the killed vaccine, maybe it worked for them, or if it didn't, measles was so common then, they tend to be like people in my age group, born before 1957, almost everybody had it. It was that common. We do not want to end up there again, and that's the reason we pay so much attention to this.
And kind of just reiterate that last part that you just said, the concern and what could happen if we don't get a handle on those people that were potentially exposed.
Yeah, well, back in the day before vaccines, nearly everybody got measles. It was pretty uniform. Because the killed vaccine didn't work so well, most of those people also got measles if the vaccine didn't protect them. We do not want to return to a time when susceptible people almost all get it. Now, it wouldn't be like everyone, because somewhere in the neighborhood of 80 to 90% of the population is going to be immune. If you can do some calculations and probably come up with close to a 90% figure, which is also what we're getting in our contacts with these patients. But there are some special groups, like I said, people who are on cancer chemotherapy, for example. Even if they were formerly immune, they may not be now because their immune system isn't normal anymore. Or this little under 20% of children who should be vaccinated but are not. are perfectly susceptible to the disease. And that's the kind of people generally who you have to worry about when there's a measles importation into the country, such as there was in Disneyland.
And in fact, Dr. Lutzen, can you talk to the number of people in this investigation in different states that might not have been vaccinated?
I'm not sure what you mean, so go ahead.
So actually, the majority of people associated with this Disney outbreak were people who were not vaccinated for the disease.
Right.
And that's why they are seeing lots of these cases.
Yes, and that every year there, for quite some time, there has been an importation. Sometimes it's very small. 1 or 2 cases doesn't go anywhere. There was an outbreak in Ohio, I believe, last year. That importation came into a community that sometimes does not routinely do immunizations. They're not particularly opposed to it, but they just don't do it a lot. It's a religious community, and that outbreak got pretty large, about 350 cases, I think, overall. So, and most of the people in that outbreak were unimmunized kids for the most part.
Going back to the patient, is she still in the hospital or let go, or?
No, she was discharged, I think, on the 7th, and is doing well. Still not feeling her absolute best, but is out of hospital.
And keeping herself still away from people? Is she still in that window of?
No, she's no longer, this patient is no longer infectious. And in fact, the infectious period stops within a few days of the onset of the rash. So you cease to be infectious even before you cease to be ill.
Quick question to the less than 10 folks. Is January 24th the date then as well for them as well?
Right.
Okay.
Right. And that all dates back to the time of exposure, which was January 3rd. We're fortunate in this circumstance that we have a single day of exposure. Sometimes you have multiple days of exposure, and that makes things a little more complex, but we just had a single day, and so after January 24th, we're out of the woods.
Are they all, just out of curiosity, are they all in the same age category, or is it all over the less than 10?
All over, because it's anyone that happened to be, on the hospital ED, CAT scan suite on the 4th floor, so it's adults, children, the whole mix of folks.
Dr. Lutzen, can you talk a little bit about what is measles disease and why we're so concerned about it?
Well, it's actually a viral disease that makes one feel really, really miserable. Most people know it as something that is a rash illness. Starts out with cold symptoms. About the only distinguishing features is there's usually not a mild but a high fever in the beginning, and people tend to have what's called conjunctivitis, which is a redness of the eyes. That's followed by a rash that starts on the face and moves over the next week or two all the way to the tips of the toes sometimes. Starts with little red dots or little flat red circles, and as it moves downward it begins to move together, making kind of big ugly red splotches. And while all that's going on, people just feel progressively worse. There are some complications. One is encephalitis, another is pneumonia. Those are probably the two things when we saw a lot of measles, but can occur even now, that can lead to fatality.
So, Dr. Lutzen, we're close to 8 o'clock or a little after. So I don't know if you want to answer if you guys have any more questions or anything.
Thank you.
Okay, thank you.